This here is a weird bone. It's called a sesamoid bone. It's a bone that forms within a tendon. It goes right between the lower portion of the femur and the upper portion of the tibia, and everyone knows what this name is. It's called the patella, or the vernacular is called a kneecap. Okay, and it forms within a tendon. So that means that tendon has to attach to the femur, go over the patella, and attach to the tibia. This area right here where the patella tendon attaches, this is called the patellar surface. Go figure. Okay, patellar surface. Then the tendon goes over the patella, and there's a little bump right here. Can you feel that bump right there? Okay, that is the tibial, since this is the tibia, tuberosity. And somebody might point to that and say, what's that? Well, you go tibial tuberosity. Or they might ask, what forms there? What attaches to that? And you go, oh, the patella tendon. Okay, so let's fill in our next box. Okay, so you have the information. The patellar, that's P-A-T-E-L-L-A-R, the patellar surface of the femur articulates anteriorly with the patella. All right, for the next line, you're going to abbreviate two words for me, and you're going to squeeze them in. You're going to write the LAT/MED. LAT/MED, which stands for what? Lateral and medial. Okay, so the lateral/medial condyle of the femur matches up, articulates with the LAT/MED condyle of the tibia. Okay, so how this should be read is the patella surface of the femur articulates anteriorly with the patella. The lateral and medial condyle of the femur articulates with the lateral and medial condyle of the tibia. Okay, when it says label this bone marking, that's the medial condyle. And duh, what does it articulate with? It's the medial condyle of the femur. By what marking does the patellar ligament attach to the tibia? The tibial tuberosity. Tibial tuberosity. Tuber, T-U-B-E-R, osity, O-S-I-T-Y. All right, see if you can follow me. The clavicle articulates medially with the manubrium of the sternum, then laterally with the acromion of the scapula. It is the glenoid fossa of the scapula that articulates with the head of the humerus. Medially, it is the trochlea of the humerus that articulates with the trochlear knot of the ulna. Laterally, it is the capitulum of the humerus that articulates with the head of the radius. Oh, by the way, the head of the radius articulates with the ulna at the radial notch. These are carpals, these are metacarpals. What's this little bone sticking out? Styloid process. In the anatomical position, what forearm bone is medial? Ulna. Very good. Then, in the pelvic girdle, it is the right auricular surface of the right ilium that articulates with the right auricular surface of the sacrum. It is the left auricular surface of the ilium that articulates with the left auricular surface of the sacrum to form the sacroiliac joint. Then anteriorly, it is the left and right pubic bone that forms the pubic symphysis by a band of fibrocartilage. Then it is the acetabulum of the os cox that articulates with the head of the femur. Then it is the lateral and medial condyles of the femur that articulate with the lateral and medial condyles of the tibia. Now, did you follow that kind of? Yeah, okay. Check this out. If you ever turned 52 or 3, and even though you skied really well when you were in your 20s, that's 30 freaking years later. Okay? If you go skiing, it's not a question of will you get hurt. It's a question of when you will get hurt. My lovely wife, who was an avid skier in her teens and 20s, her parents had money. They used to go to Vail, Colorado all the time, okay, and go skiing, okay, which I think is stupid because who's going to strap on wood and go down a hill with almost near zero drag coefficient? Doesn't make sense to me, okay? But anyway, she got forced off the bunny hill into the moguls. You know what moguls are? They're bumps. And she went up into the air, and when she came down, this part of her leg twisted over here like this so that the lateral condyle crashed into the medial plateau of the tibia, crushing it. Okay? How she did not tear a tendon, I don't know. No tendon was turned. So basically, it's called a plateau fracture. This right here was just crushed down. So they had to go in there, cut the leg from right here up to the middle of the thigh, pull back everything like that, and then start reconstructing this and putting putty in there, which is called bone putty. It hardens. And they bring this back up, and they get it as close to anatomical as you can. Also, there is a meniscus, a pad that goes between the condyles. That was not torn either. Okay? But what they had to do was then, after they get this back to anatomical, they put a plate like this and another plate over here and then screw it in with 6 screws on both sides. So that's what her leg is right now. It's just a big fracture. And she actually was thinking about going skiing again this year. This happened like 2 years. Oh, by the way, when you have that kind of surgery, that kind of operation, guess how long you can't walk on your leg? Yeah, 4 to 6 months. Okay? So you got to be careful about that. All right?